Today, we'll delve deep into the 12 weird signs that could indicate your liver needs some attention and care. Recognizing these signs is important because you can prevent the condition from getting worse, and your liver can recover with a bit of support. Ignoring signs of liver damage can lead to consequences that might impact your overall health. Liver disease is affecting more than a quarter of people worldwide, and this number is on the rise. While many think liver damage only happens from excessive alcohol, it can also result from consuming too many sugary or processed foods, excessive use of certain oils and fast foods, and frequent painkiller use like acetaminophen or ibuprofen. Viruses, too much iron, and exposure to toxins like pesticides and plastics can contribute to liver issues. To see if your liver needs attention, stick around until the end of the video. We'll also discuss simple home remedies to keep your liver healthy. Remember, this video is for learning purposes, so consult your doctor if you have any health concerns. Number 1. White eyelid growths. Let's begin with the first weird sign, which is white eyelid growths. It is an unusual sign that your liver might be facing issues. When you observe small, white or yellowish growths around your eyelids, it could be a sign of potential liver damage. These growths are like tiny pockets of cholesterol deposits gathering under your skin. The reason behind this is that your liver struggles to break down cholesterol properly, leading it to accumulate in various areas of your body. Recognizing these signs becomes crucial in understanding and addressing potential concerns related to your liver health. Number 2. Poor night vision. The second sign to watch for is having trouble with night vision. If you notice that it's becoming harder to see clearly, especially in dim lighting, it might be a sign of not getting enough retinol or vitamin A. Your liver's bile is crucial for absorbing vitamin A, which helps your eyes adjust to different light levels. But if you have liver disease, this process gets disrupted, and you may not absorb sufficient vitamin A, leading to a condition called night blindness. This change in vision could also be a sign of a congested gallbladder, especially if your eyes feel excessively dry, sore, irritated, or gritty. Number 3. Pale stools. Another clear sign of liver issues is having pale stools. When you use the bathroom, your liver normally releases bile acids to help break down fats in your food, giving your stool its usual brown color. However, if you're dealing with fatty liver disease or liver damage, this bile doesn't flow as it should through the bile ducts. This can result in your stool becoming lighter, paler, or even clay-colored. Sometimes, you might notice it floating on the water's surface due to undigested fat making it buoyant. If you are finding this video helpful, please consider subscribing to this channel for more amazing health videos. These changes in the color and texture of your stool can serve as an alert that your liver might be experiencing difficulties. If you observe such alterations, it's important to take notice and consider seeking advice from a healthcare professional to better understand and address your liver health. Number 4. Dark urine. Sign number 4 involves observing changes in your urine, and it's crucial to understand what this could indicate about your liver's health. Your liver has the essential job of breaking down old red blood cells, which contain a yellowish pigment called bilirubin. However, if your liver or gallbladder is damaged, this pigment can start to accumulate in your body. As a result, it gets flushed out through your urine, causing it to take on an unusually dark color, ranging from a strong orange to amber, brown, or even resembling cola. In simpler terms, if you suddenly notice that your urine has turned significantly dark, it's like a signal from your body that there might be an issue with your liver or gallbladder. This change occurs because your liver isn't processing the pigment as it normally would. It's important to note that certain medications, such as antibiotics, sleeping pills, or birth control pills, can also contribute to this darkening effect by putting a strain on your liver. Number 5. Purple and red spots. The fifth sign to pay attention to is the appearance of purple and red spots on your skin. If you notice these unusual marks, especially around your lower legs or arms, it might be signaling potential liver issues. Here's why. When your liver is congested, inflamed, or damaged, it produces fewer proteins crucial for normal blood clotting, making you more susceptible to easy bruising. These spots, resembling a rash or small red patches, are often a result of poor blood circulation linked to liver disease or possibly diabetes. So, if these marks are popping up on your skin, it's like your body's way of telling you that there could be something off with your liver. Number 6. Yellowed skin. When your skin takes on a yellowish hue, it's a visible sign that your liver might be facing issues. Normally, the liver filters out a yellow pigment called bilirubin, but if it's not working correctly, this pigment can accumulate, causing jaundice, the yellowing of the skin. Jaundice serves as a warning that there could be significant liver damage, potentially due to conditions like hepatitis, cirrhosis, or even harmful effects from certain drugs. Seeing your skin turn yellow is like a clear signal from your body that your liver needs attention. Number 7. Swollen right foot. The seventh sign to pay attention to is a swollen right foot. When your liver's blood flow is disrupted, it can lead to swelling and enlargement in the foot. This happens because there's increased pressure on the portal vein. This elevated pressure causes fluid or water to build up in the legs or feet. A simple test is to press your finger into the swollen area. If it leaves an indentation, it's a notable sign. If you observe more swelling in the right foot and ankle compared to the left, it's a common indicator of potential liver damage. To address this concern, natural remedies for enhancing liver function will be discussed later in the video. Understanding these physical changes, like swelling, can be crucial in identifying potential liver issues. Number 8. Right-sided pressure. If you experience pressure or pain on the right side of your rib cage, especially after eating, it might signal potential liver issues. Here's why. When your liver is damaged, bile turns into sludge, clogging up the little tubes linked to your gallbladder. This blockage leads to a sensation of pressure and pain around the ribs, creating discomfort. Additionally, it can put pressure on the phrenic nerve, causing muscle tightness and pain around your right shoulder. So if you're feeling this kind of discomfort on the right side, especially after meals, it could be your body's way of telling you that there might be something going on with your liver. Number 9. Itchy hands/feet. If you're constantly feeling the need to scratch the palms of your hands or the soles of your feet, it could be a sign of liver disease. This itchiness is caused by a buildup of bile acids under the skin. Normally, the liver filters out these acids, but when it's not functioning properly, they accumulate, releasing histamines into the blood and triggering the itchy reaction. In simpler terms, when your liver struggles to remove certain substances, it leads to this uncomfortable itching sensation. So, if you're finding yourself itching frequently, it's like your body signaling that your liver may need attention. Number 10. Cracked heels. Now let's talk about cracked heels, another potential sign related to your liver. Your body relies on vitamin B3, also known as niacin, to keep your skin strong and smooth. This vitamin helps prevent damage and keeps your skin moisturized. However, if you have liver disease, your body uses up its vitamin B3 stores to repair damage, leaving less for other essential functions. The result? The skin on your feet, especially the soles and heels, starts to crack. It's like your body's way of saying, hey, something's not right with the liver. Cracked heels become a visible indicator of potential liver issues. To address this, you can increase your intake of vitamin B3 and work on the root cause, in this case, fatty liver disease. Loading up on foods rich in vitamin B3 and making dietary adjustments can help improve the condition of your skin. Number 11. White or clubbed nails. If your fingernails start turning completely white, losing their normal pink hue, or if they become rounded, clubbed, or bulbous, it might be signaling serious liver damage or another underlying health issue. This happens because there's an obstruction preventing oxygen from reaching the nail matrix, the base of the nail where growth occurs. In simpler terms, if your nails are all white or taking on an unusual shape, it's like a signal from your body that something might be wrong with your liver or your overall health. Back in the 1950s, researchers found that 8 out of 10 people with severe liver scarring had these all-white nails. Number 12. Spider veins. These are like small red dots with spider-like extensions of blood vessels visible on the skin. Their appearance is a result of damaged blood vessels, attributed to the liver's struggle to effectively filter out excess estrogen. When estrogen levels are high, blood vessels weaken, leading them to dilate and become noticeable on the skin. If you notice any symptoms we talked about, it's important to act. Consult your doctor. They might suggest an ultrasound, a simple test using sound waves, to check your liver. The good news is the liver can get better. You need to deal with its stages. First, it gets fatty, then it gets inflamed, followed by forming scars, fibrosis, and, in serious cases, cirrhosis. What you eat matters. Avoid too much sugary stuff and go for healthy foods like greens and garlic. Drinking coffee with turmeric can help, and don't forget to drink enough water. Try intermittent fasting. Eat all your daily food in a 6-hour time frame. Avoid unhealthy oils, but for good ones like olive oil. Include herbs like ginger and turmeric in your diet. They're good for your liver. And if your doctor recommends, consider taking bile supplements in the morning. They can help your liver get rid of extra fat and reduce inflammation. We appreciate your support, and don't forget to check out this video. If you like this video and want more informative content, hit the like and subscribe button below. Feel free to drop a comment if you have any questions or insights to share.